Less than 24 hours, Georgians will be under a shelter-in-place order.
McDonald, though, said he did not know the man was handcuffed and was trying to use his foot to pin him to the ground so he could be handcuffed.
If your friends, neighbors, or local organizations are not complying, report them to us.
Howdy, ladies and gentlemen, and welcome to the Free Georgia Podcast. My name is Jake Green. Thank you all for joining us today. We are first going to talk about the Great Create, which is happening May 12th through the 14th in Cherokee Pines, or at Cherokee Pines in Perry, Georgia. It is a DIY festival that is doubling as the Libertarian Party of Georgia's yearly convention. But the first 2 days are a DIY Freedom Festival, mainly focused on being self-sufficient, being able to do things yourself, learning new skills, and all that kind of stuff. We've got some great speakers coming, including Reed Coverdale, Shane Hazel, Edgar Mills, and John Mons. And today, joining us, we've got Mr. Dave Miller from Frontline Medical Defense. Dave, thanks for coming on the podcast.
Absolutely. Thank you for having me.
Absolutely. First off, why did you, or can you give us a brief rundown on what Frontline Medical Defense is?
Yeah. So we're a small business based out of Cobb County, Georgia, but we service kind of the whole metro Atlanta area, kind of all over the state, just kind of really depending on where the need is or where our customer is. We started out of 2021. What I saw was a lack of training and quality first aid kits that were available out on the market. And again, that person-to-person, in-person training that was maybe a little bit more than your normal first aid training. So we are CPR instructors, AHA instructors. I'm a stop the bleed instructor. And then we've developed some of our own first aid basics courses that we teach, and some of them we package all together as like a 6-7 hour course that will take the customer, the client through, again, getting a CPR certification, stop the bleed certification, and then some basic first aid essentials, talking about what should go in a first aid kit, why this should be in a first aid kit, maybe some of the different varieties of first aid kits. So we teach that, and then we sell all of those goods that go in it. So we can custom build you a first aid kit for your business. We've taught at YouTube studios. We've been to churches. We've been to private gun clubs. We recently sold some kits to a local police department. They were putting in their vests. We've got big medical cabinets that we've put in some locations that we service on a quarterly basis. Then we've got e-commerce as well. So we've got a whole range of first aid kits that you can look through and buy. And again, we do custom order stuff. We've had people call from, fly fishing boats up in Montana to, again, large medical cabinets to go kind of OSHA compliant anywhere. And so it all kind of stemmed from, I'm a full-time firefighter and paramedic for a local metro Atlanta department. I've been there for 16 years and been a paramedic for the last 10. I was an EMT before that. Really we run some calls and we don't use a lot of stuff on a lot of calls. But you'll go to Walmart and buy a kit that's got 1,000 Band-Aids in it. And it's really not what you need. And some of the stuff we're going to talk about there at the Great Create is kind of bridging that gap between when you get injured and when a first responder actually arrives on the scene, and trying to survive the gap that is there between, when something happens and when somebody arrives.
Gotcha. You kind of, man, I have so many questions now, but that's just opens up a whole box. First off, why did you kind of touched on it a little bit, but why did you start this in 2021?
Again, so I just feel like, I wanted to start a business. It was kind of, the impetus for it all is I want to do something. A lot of firemen have second jobs. That's pretty standard on our schedule and income. And so what did I know how to do? And again, we run the ambulance service where I work. So we ride the ambulance every couple of shifts. We're on the fire truck every other couple of shifts. And, so what do I know? Well, I know first aid, I know EMS, I know how to treat injuries. And again, the lack, I think, of education out there in between, surviving the injury and surviving to definitive care. And then the equipment really that gets it done. I feel like is an important part to get out in the current atmosphere and climate with, COVID was so rampant and the fear was so present with it, then to school shootings and mass shootings. So the Stop the Bleed is a really big thing that I enjoyed teaching. It's a smaller program. Not sure if you've ever heard of it or not, but it's a newer program developed out of the Sandy Hook school shooting. They kind of got together and said, how can we stop people from dying? And essentially came up with the Stop the Bleed, Save a Life. So I really enjoy teaching that. And again, that goes hand in hand with teaching people how to survive, the average national response of a first responder, which is 7 to 10 minutes. And if you can't survive the interim, well, you don't have a really good chance of surviving to definitive care.
Yeah, that's true. Okay. You said something about becoming a paramedic after being an EMT. Can you tell people the difference between those two? Because I don't think a lot of people know what
Yep. So basically it's just a difference in scope of practice. EMT school for me, I did prior to my employment with the fire department. And it was out of a technical school. It took me, I think it was 8 months, once or twice a week for a couple of hours. And then you pass your national registry tests and the psychomotor, all that kind of stuff. And then you can do a little bit of stuff. You can bandage wounds a little more appropriately. You can give a little bit of medications. You understand how to remove somebody from a vehicle and kind of do your basic assessment. So after a few years of being the EMT and teching calls in the ambulance that were low acuity, so not very bad nature calls, we stub toes and upset stomach and maybe a broken bone here or there as a EMT. So my department hosts their own paramedic school. So I opted to go through paramedic school, and that was 2 or 3 times a week for about a year. So the schooling is vastly different. Now it's even longer. Think upwards of 15, 16 months to get through paramedic school now. Hundreds of hours of schooling, hundreds of hours of clinicals in the ER, the OR, OB, psych. You go through all of these different levels of understanding. So then along with that, you can read EKGs and do 12 leads, look for heart attacks. You can understand different rhythms. Then you're able to give a lot more drugs for, pain management and nausea, vomiting. A lot of it is the cardiac drugs that we add in there along with narcotics.
Wow. Okay. So it seems a lot more intensive to be a paramedic.
It's a lot more intensive, and the responsibility lies a lot more on you. When something goes bad, they look to you and think, okay, what are we doing? And you got to have a game plan. Now we've got protocols. There's a doctor that writes all of our protocols for the department. And then we can call the hospital. I call the hospital, not all that regular, but if I come up to something I'm not sure what to do, or a dosage or a whatever, I can call the hospital, the receiving facility, and say, hey, this is what I've got. These are the drugs I have. What do you recommend we do? And they kind of help lead you down the path of treatment and management. So you're not out there alone, but you're working, trying to do things in the back of the ambulance, going as quick as you can to the hospital down bumpy roads, and trying to keep people alive is it's fun and it's interesting. I can't sit in an office all day. I got to do paperwork occasionally, and it's tough on me. So
yeah, I can completely understand that. What made you start out being a fireman?
So I guess I just wanted to help people. I was in the Navy very briefly, back right out of high school. So I came back and was kind of faltered a little bit. I went to Kennesaw State University, kind of working on a business degree. And then, I don't know, I was living with some roommates and just kind of like, you know what, I think this is what I want to go do. And I convinced one of my roommates to go to EMT school with me. So we both went to EMT school and actually got hired at the same fire department, went through the same recruit school, and we've both been there now for the past 16 years. And, you know, for me, and it's the business thing as well. And again, coming to the Great Create to teach people, you know, if you can make anybody go home or allow them to go home, it's all worth it. You know, you're able to get that mother, father, daughter, son, child back to their loved ones, whatever the circumstance may be, you know, whether it's out of a car wreck or a fire or, you know, an illness or injury, being able to help those people go back home, be with their loved ones is what makes it worth it. You know, I'm married, I got 2 kids, and I want somebody to come help my family in the time of need if I'm not around. And that's kind of what the fire department is, what EMS, police, you know, when somebody doesn't know what to do, they call 911. And, you know, so that's where we come in. And that's why I think it's also really important to have a couple of classes under your belt so that, again, that national average of a response time is 7 to 10 minutes for a first responder to get there. And if you have to do CPR on somebody or they're not breathing, no pulse, you've only got a couple of minutes to keep the blood pumping around the body. Or you come across somebody who's got a massive bleeding injury, you've only got a couple of minutes to put a tourniquet on somebody in the appropriate way to stop the bleeding and allow them to get to that definitive care and have surgical intervention. If you miss that window on the very early onset, your outcome is a lot poorer than if you're able to have some sort of intervention in the interim waiting for a first responder to get there.
Interesting. I've got here, I'm going to pull up your website real quick because I've got it queued up. Talking a lot about courses, and I was looking through this website before we started talking. What courses would you recommend to like somebody who just wants to start out? Like what are
Yep. So that core immediate responder course is something I've kind of developed as kind of going through the times. I was actually at a YouTube studio doing a class and recording one of their videos. And I kind of got talking on like, well, the 2 classes I think everybody should have is CPR and stop the bleed. You know, so that's this core immediate responder course I kind of put together that you're going to get your CPR certification. You're going to get your stop the bleed certification. And then we're going to touch on some first aid essentials and basics about, you know, what normal heart rate is, what's a normal respiratory rate, how do we assess somebody's level of consciousness. Then we get into, you know, if you're going to build your own first aid kit, what should be in these first aid kits to actually make a difference. Again, you don't need 1,000 Band-Aids. You need a couple, I feel, essential items really, again, to bridge that gap between point of injury and either the first responder or that definitive care. If you can't survive that interim, you're not even going to make it to the hospital. So that core immediate responder course, you know, we can come on site and teach that. This one is specifically hosted out of a gun range in Jasper, Georgia, and that's $100. That's a 6 or 7 hour course. Okay. Then again, we teach CPR occasionally. We teach stop the bleed again individually occasionally. We've got course dates on there. And then again, you can hire us in. We kind of have a minimum dollar amount where we'll come to your facility and we bring all of the teaching aids with us, the course curriculum, the fake legs, all that kind of stuff, and allow you to, you know, we got wound simulators that bleed. Wow. So we try and bring everything with us. So you really have stuff to do is show up and take the training and listen. It works a lot better when people are into it. Typically, like I've taught some other first responders, and they're great, but they're just not as enthused. You know, somebody that has hired me in or their business or they're paying to come take the class, they are really interested in the class. They are there for the reason, as opposed to somebody else is like, hey, I want you to go take this class. And like, okay, it's part of my job. I got to take this class.
Right.
So again, you know, those 2 classes for me, CPR and stop the bleed. I think if everybody in the country has those classes, we're going to be on the road in a good way to being able to save some lives, you know, all across the country.
That's pretty cool. I like how much it covers too, in like just 7 hours. That's amazing. I like that it's a combo of those other two classes. Yeah, I've become really interested in some of this stuff just because my wife and I are moving out into the mountains, pretty far away, and we're doing a lot of construction and all that kind of stuff. Like it's 45 minutes, 50 minutes to the closest hospital.
Yeah.
So like for that kind of situation, I was looking at some of your kits and stuff. Would that be like a build your own kit, or do you have a kit that you would recommend for something like that?
Yeah, so probably either the Expedition Medic Pack or that IFAC Elite would kind of be an all-encompassing first aid kit that's going to have your chest seals. You can get it with wound packing gauze that's impregnated with a hemostatic agent, along with, Band-Aids and some basic medications. The Expedition Medic Pack, when it's built all the way out with their all the choices picked, is the one that I carry in my car. That again it's got a little bit of everything in it. Not one of these kits is going to be your last 5 years first aid kit. You'll never have to restock or anything like that. These are designed for, they're portable. They move with you, or you can stick it in the house. But again, the Expedition Medic Pack's only got, I think, 10 or 15 Band-Aids in it. It's not having the 1,000. So if you're going to it time and time again, you're going to run out of those. But again, it's designed to cover you for roughly 5 days worth of injuries, and then handle, again, if you get it with the tourniquet, a TCCC recommended tourniquet and chest seals and wound packing gauze, again, you're going to be on the right road to recovery.
Gotcha. Before I found your website, a few months ago, I was looking, for med kits and stuff like that. I found a site called My Medic.
Mm-hmm.
Have you heard of this site? What can you tell me any differences between y'all's products?
Be honest with you, not particularly. I've been to their website and some other of the competition when I was, originally building, designing, whatever. There are a bunch of people that do. I think that's what is good about capitalism, right? You can have a couple people doing the same thing, and it's hard to get people into medical, though. We've again been to some gun ranges and Atlanta Range Day. We were there for them for medical coverage.
Oh, nice.
And so long as you've got a kit, I think that's the important part. There's a bunch of people doing a bunch of stuff out there, and again, so long as the basics are there. Again, I think a TCCC recommended tourniquet is a fantastic way to start. And those things usually range around $35 for one of those tourniquets, like a cat tourniquet. But yeah, not specifically that they do or don't do. They've got a lot of advertising. I'll say that. I think their advertising budget is what makes them a powerhouse out there. And my marketing budget is not there.
Well, let's try to fix that.
Yeah.
So let's talk about the Great Create for a second. A lot of good folks coming out. A lot of cool like booths and stuff for people to learn new skills and figure out kind of what they want to look at to be a little more self-sufficient and self-reliant. Right. What I know you touched on a little bit earlier, but like what all are you going to be doing or showing or selling while you're there?
So I believe we're going to have a little spot as a speaker, if I understand correctly. Cool. 15 to 30 minutes or whatever they've allotted. And in that time frame, we'll touch on, again, this bridging the gap concept, and talk a little bit about CPR, talk about stop the bleed, talk about some basic first aid skills. And then I plan on bringing some CPR dummies with me, some wound packing dummies with me, and tourniquets and stuff, so that maybe we do the class portion, again, this is why you need to be prepared. This is how we can be prepared. But then again, allow people to put some hands on and practice some basic skills of, again, pushing on the chest for CPR, and where and how to apply a tourniquet and what it feels like to apply a tourniquet. So that's my plan as far as the speaking part there, is to touch on, again, bridging that gap, allowing people to put some hands on. And then we'll also have a vendor slot so that people can come up and talk, and we'll have all that stuff there. Again, if somebody missed the the talking points, they can come and again apply a tourniquet at the booth. But then we'll have some first aid kits there for sale,
Cool.
and all the components that go along with it.
Oh, that's awesome. Okay, I'm looking forward to that. Yeah, like I said, I've been really nerding out about all this medical stuff since I realized I'd be like 50 minutes away from anybody who could possibly help me.
Yeah, you know, too, like a lot of people don't understand that not all hospitals are created equal.
Mm,
You know, there are different levels of hospital, a level 1, 2, and 3. Trauma centers are, they're not all created equal. You know, we try and get you to the best facility that we can, but depending on your symptoms, your injury, we got to go to specific facilities. So typically the further out you are, you know, your closest hospital is probably going to be more of a rural hospital that's not the best facility for everybody. You know, I'm not saying that it's a bad place, but there are better places sometimes, different specialties. You know, we've run a guy who cut off several of his fingers, you know, and he's like, oh, take me to this hospital. I'm like, well, if you ever want to use your hand again, we don't want to go to that hospital. We want to go to one that's further away. And a lot of times people don't understand that there are differences, and they think, well, a hospital is a hospital. And
right.
but that's what we're trained in. That's as the EMS agency, the paramedic, to understand that, again, not all hospitals are created equal. Or when do we call for, you know, air transport via helicopter and all those kinds of things. We have that ability to implement. So again, some things I don't know where exactly are moving, but to investigate the hospitals around you, and see which ones offer kind of what things, so you can make an informed decision if you ever have to call 911 and they say, well, let's go to this hospital. You're like, well, I don't know. I know this hospital's better. They might look at you begrudgingly, but ultimately you have the final say on where you go.
Gotcha. And is it just talent at the hospital, how it's run, or just some hospitals specialize in different things?
So a little bit of both. Some hospitals specialize in certain things, like the guy that cut his fingers off. We went down to, I believe it was Piedmont, Atlanta. Piedmont, Atlanta. They do better micro surgery.
Gotcha.
Whereas like Grady is the place to go for burns, or Cobb General, I think, is another good place for burns. CHOA, right, is a great place for children. Then if you're looking for trauma, you know, a bad traumatic injury, bad car wreck, long bone fracture, stuff like that, you want to go to a trauma facility. So Kennestone is a trauma facility. North Fulton Hospital, AMC, which just closed in Atlanta, was a level 1 trauma center. So that's thrown a wrench in some stuff because they closed a major receiving facility. So now those patients have got to go somewhere else. So a lot of the other hospitals are taking that influx of patients because they don't have as many choices to go. You know, some places are better at handling strokes. You know, certain hospitals can go in and pull a clot out of your brain and help you, you know, recover from a stroke or something like that. So again, a lot of them are set up differently. Some of them are teaching hospitals. Again, level 1 trauma centers are supposed to be teaching hospitals that have everything available all the time. Whereas like a level 3 doesn't have a lot of that stuff on site or available at all. I've run heart attacks before and brought them in, and they let us come into the cath lab with them. And we get in, and the doctor's looking, doing his thing, and he finds where the blockage is, and he says, shoot, I can't do anything. I got to ship him out. You know, like, well, dang, if I had known that, I would have taken him to a different hospital where he could have done open heart surgery right now versus, you know, we're delaying. They've got stuff they can do, and balloon pumps and all sorts of stuff to help with blood flow. But again, being the informed citizen and informed person on your own right, and knowing, you know, not necessarily all of those intricacies, but knowing a little bit about some of the receiving facilities, again, I think will be good.
Wow. That's very interesting. I never really thought about that aspect of it, of like needing to go to different hospitals based on what kind of injury it is.
Yeah.
So yeah, I just thought, just take me to the hospital.
Right. And again, but that's, you know, that's what we're trained and paid to do, is that, you know, but sometimes people don't want to listen to us. You know, it's like, hey, you need to go to this hospital. I don't want to go there. And I'll tell them, I say, well, you understand, I'm telling you, I've been doing this for 16 years. My professional recommendation is you go to this hospital. And they're like,
right.
Okay. Yeah. Take me the other place. I'm okay. that's on you. You know, that's what you
Gotcha.
want to do.
How often does that happen?
Not that often, but you do run into it, and it's frustrating because you're like, I'm trying to help you. This is my job to act in your best interest.
Right.
And I'm telling you, the hospital you want to go to is not where you need to go. And sometimes I'll tell them I'm gonna have you sign something saying that I told you that this hospital was better for you, and you're refusing to go to that hospital because it's again, we've got time standards, all this stuff, and all the hospitals have time standards on, coronary reperfusion and all sorts of stuff, and then they get mad at you too that you come up with something they can't handle, and then you'd be like, well, they wanted to go there, they have the ultimate decision, and then they look at them like, well, okay, we'll just ship them out later.
People are stubborn, man.
Yeah.
People don't like thinking about terrible things happening. People don't like focusing on that. So like, how do you, or how would you go about like trying to get people to think about this without kind of being a giant downer?
Yeah.
Because that's got to be tough.
So again, I think it really goes back to that for bridging the gap concept for me. So again, if you tell somebody, if you ask them what the national average response for a first responder to get to their home is, they couldn't tell you. They think, oh, it's fast. Okay, well, what's fast?
Right.
That's what we do. We try and get there as fast as we can, as safely as we can, to mitigate the emergency. But they don't put a number on it, right? So the standard average is 7 to 10 minutes across the country. Some's longer, some shorter, but 7 to 10. Okay, so now I know how long it takes. Okay, well, now do you know how long it takes to bleed out, to bleed to death? Well, no, I don't know that either. Okay, well, if you hit the right artery, it's 3 to 5 minutes. Okay, so that's kind of how you get their interest peaked. And well, okay, so I'm telling you, the national response is 7 to 10 minutes, and you can bleed to death in 3 to 5. So those numbers don't line up. And that's what I try and get that point across, is that not trying to scare people, but just trying to have them be prepared. Again, having a tourniquet around, is something a lot of people don't think about.
Right.
And obviously I'm more in it than probably anybody else between business and working in the fire department and EMS, but people don't understand timeframes like that. So when you can spell it out that those are national averages and these are medical timestamps that, really you can be unconscious and unable to help yourself in 60 to 90 seconds if the right artery is severed. Oh, okay. Well, I kind of get it. And it's the same thing with CPR, right? I mean, you've got to have that blood flowing constantly. And if you wait 2, 3, 4, 5 minutes, the increase in brain damage just escalates every second the brain goes without oxygen. So again, if you're a bystander and you're not going to do CPR on somebody because you either don't know how or you don't want to, and you're waiting for that first responder to get there again in 7 to 10 minutes, well, it's kind of too late. If you've watched somebody collapse and you just stand by and do nothing, they're probably going to be brain dead and not revivable by the time the first responder gets there. So I think trying to put really the numbers in front of people, again, not to scare them, not to scare them into buying a first aid kit, but to bring awareness to the fact that you got to be your own advocate.
Yeah, I like that. I also like the idea of like doing it just in case you're needed. Those skills are needed somewhere that you are. Those are pretty good incentives for me. So I mean, like
in the emergency, it's always they're looking for somebody else. Well, maybe that person will help, or maybe that person will help. It's the new concept is kind of going around. It's called the immediate responder, which is where that core immediate responder course comes from. Like I would consider myself a first responder, right? We get on the scene and we assess and do our thing. But if somebody is there during a mass shooting or during a car accident or a family member is choking, you're there right now. You're the immediate responder. So it's kind of just a new concept coming around, is this, that the people on scene already are the immediate responder. Then the first responders, the fire and EMS and police, get there, but that immediate responder is there and able to help right off the bat.
Right. That's cool. It's been about half an hour. What do you have, like any just basic advice or thoughts for people to take with them before we head out?
Gosh, not aside from what I've been harping on, that those numbers to me, they just don't line up,
Yeah.
Take a first aid course. You don't have to take my course. I mean, you can get into a CPR course anywhere in the country,
Right.
Stop the bleed is not as prevalent yet. There's a few people. I've taught a lot of people in the state of Georgia who are becoming instructors of Stop the Bleed. A couple of years ago, there was like me and one other guy in the whole state teaching Stop the Bleed. But yeah, just look in for yourself on the time frames of survival and the chains of survival, and do a home audit, for yourself, and think, okay, if something happens, do I know how to be prepared? A little bit of something I've been working on is something called the asset mindset that I've been kind of tinkering with, but just how can you be an asset during whatever emergency is going on, and not a liability. If you're able to, again, give somebody some medical assistance or be the one to let somebody go home again, that's all worth it. The 1 hour of your day, or 6 hours of your day to get some training, I think is well worth it.
Yeah. I think that's something that people don't do nearly enough, is think, I like what you said, that be an asset rather than a liability. I think people focus on themselves a little too much sometimes and don't think about the big picture.
Yeah.
Well, your website is frontlinemedicaldefense.com. If you want to go look at training, any of his kits, or just look at his blog, go over there, and frontlinemedicaldefense.com. It's a good website. I was on it for about 30 minutes before we started talking.
We got Facebook and Instagram, TikTok, all the social medias, trying to branch out and get out there. We put some teaching stuff up on there too, as long as you can, the 60, 90-second clips, but there's lots of good resources out there to learn stuff for free, so
let's see, your next class for the core immediate responder is April 29th at 10 a.m.
Yep.
At Appalachian Gun Range in Jasper, Georgia. And then let's see, you've got Stop the Bleed coming.
Yeah,
you just had one. Gotcha. Yep. Yeah. May 20th. Yeah. 9 to 1. And then do you do CPR classes, or just is that
yeah, that's more on request.
Gotcha.
If somebody hires us in, or any real number in, just call us and we can set up a class for you.
Okay. Awesome. Dave, this has been very enlightening. I appreciate you coming on. Thank you so much.
Absolutely. Thank you for having me. I appreciate it.
Absolutely. Well, y'all, go get your tickets for The Great Create, so you can come out, and I'm going to put it up here one more time. You can come out and meet Dave, learn a lot from what he has to say, and learn from all these other awesome speakers, awesome presenters. It's going to be a great time. $42 for adults. It's free for kids 16 and under. So go ahead and get your tickets now before it gets, I think it can get sold out. I think it's limited capacity at some point in time. So that's it for this week. We'll be back again next week. Sorry, I've been off every other week for the past past month, I guess. Been doing a lot of life stuff. So thank y'all for tuning in, and we'll see you next week.